Good evening, everyone. My name is Angelina Navarro from ASVN3. Today, our final discussion is going to be about side rails. Let's start off with everybody. Let me asking everybody this question. What are your feelings about side rails, specifically as a healthcare individual? Let's start thinking about that. Do you feel that they provide safety and security for our patients, or do you feel that they put our patients at risk? Everybody is going to have a different opinion. Everybody's views are going to be different. So we just want, to initially start seeing what your own personal views are going to be. Us as healthcare individuals know that there are going to be so many contributing factors that we need to take into consideration when we are thinking about side rails and our patients. Let's see. So, for example, we need to take into consideration our patient's cognition status, our patient's mobility status, our patient's current overall state of health. We want to really know our patient. We want, us as healthcare individuals, we know that we ultimately need to treat the patient as a whole and not treat the patient's diagnosis. That's very important that we need to realize and remember and keep in our mind is we're not treating the patient's diagnosis. We are treating the patient as a whole. So although the diagnosis of our patient is very key, we need to, think of our patient and focus on our patient as a whole. So I know that as doing my own research, and the CBSC, the Consumer Product Safety Commission, has reports that sometimes are not very favorable on side rails, which is why I wanted all of us to keep an open mind and think about that. So the CBSC has reported 155 deaths and 5 injuries related to portable side rails. This is from the time July 2003 and September 2012. 143 of those were related to the side rails entrapment. 11 of those were related to patient falls out of bed on the side rail. And one of those was a victim hit his head on the side rail. So, is it appropriate to consider all side rails a restraint? I personally truly believe that it must be evaluated case by case, evaluating the patient's current health status and evaluating the patient one-on-one, and letting that patient needs be that whole patient's needs be your point of focus. So, let's just say our patient, for example, does this provide the patient's security and safety? Say your patient is paralyzed. If your patient is paralyzed, they are already lost so much of their functional status. So think about it. If you're paralyzed, you already lost so much. And the side rails can help you maintain that little bit of independence you have left. They can help you be able to pull yourself up in bed, reposition yourself up in bed to maintain your level of comfort. So we want to keep that in mind, that that so you won't have to ask for assistance. So you'll have that little bit left. Would we want to take that away from a patient who is alert and oriented and they're not cognitively at risk to hurt themselves, who know what they're doing? That's a question. Do side rails put our patients at risk for injury? Again, absolutely they can. If the patient is not oriented, yes, it has been proven. They can, get their head stuck in the side rail and harm themselves, try to climb over the side rails and harm themselves. But this is why I say it's super important that we, it's case by case. Each patient needs to be evaluated independently what their need is. Each patient's need is going to be different, less or greater than others. So some people are going to say, yes, absolutely, they're a risk. And some people are going to say, no, they're not. Everybody's opinion is going to be different. Um, so let's also talk about the discussion of the deaths and from what CBSC has reported. Of course, you're going to hear things that are reported that are poorly. But a lot of times the things that are not going to be reported. So let's keep our patients' dignity and independence in mind, as well as their safety and what puts them at risk. So, after taking into consideration all the contributing factors, including the reported instances, I truly believe that restraints cannot all be labeled as a restraint. They need to be evaluated case by case, patient by patient, making the patient our focus point. As nurses, especially, we're the patient advocates. What is best for our patient and for the patient's needs, physical, mental, and health needs. Again, we are the advocates for the patients, and we must contribute and continue to support our patients and protect our patients and their rights. Really quickly, I also wanted to just point out just a little thing I put together for our. This is just some pros and cons and exactly what we went over. Just some key points just to keep in mind. This can also, when you're thinking about it real quick. Some sources that I also wanted to cite is the FDA.gov medical devices. That's somewhere where I got a lot of very, very interesting information. So thank you. Have a good night, and thank you for listening. Bye.